Hello guys, this is Anurag Kannur. Today I am here with the concept circulatory system. It is meant for NEET. I have taken the concept directly from NCERT textbook of your 11th class. So I made this concept as simplified as possible. So I will be studying related to circulatory system. In that particular thing related to heart. What are the subtopics that are covered in this particular topic? So anatomy of heart, conduction of heart, cardiac cycle, cardiac output, ECG, how your cardiac activity is regulated, and the disorders related with the heart. So you guys must know. Just consider this as your rough diagram. Consider this as your heart. It has 4 chambers. 1, 2, 3 and 4. So your heart is derived mesodermally. Mesoderm derivation. Just remember this one. And we have 4 chambers. Those 4 chambers are, first one is, this one is your right atrium. On the left hand side, we have left atrium of the same one. Left atrium, the top one. In the bottom, on the right side, it is right ventricle. And on the left side, we have left ventricle. These are the 4 chambers of our heart. So respectively, see, this one is right atrium, left atrium, right ventricle and left ventricle, mesoderm origin. And we need to know regarding layers of heart. We have 3 layers of heart. P, M, E. It is from outer to inner. So on the outer side we have pericardium. There is a technique to remember this pericardium. See, covering of your bone is called as periosteum. Covering of your chondrocyte cartilage is called pericardium. The outermost is peri for almost all of your organs in the body. In the same way for your heart, it is pericardium. Then it is myocardium. On the innermost side, we have endocardium. Okay guys, so on the top, in your heart, over here, we have right atrium and left atrium. Right atrium and left atrium. In between that, we have got interatrial septum. This one is interatrial septum. Interatrial septum is between right atrium and left atrium. The wall, left atrium. The wall between left atrium and right atrium is called interatrial septum. In the same way, the wall between right ventricle and left ventricle, right ventricle and left ventricle is called as interventricular septum. See over here, this one, this particular part is interventricular septum. In the same way, this one is right atrium and right ventricle. In between these two, we have atrioventricular septum, this one, which separates right atrium and left ventricle, or right atrium and right ventricle, and left atrium and left ventricle. That is atrioventricular septum, which separates like wall between right atrium and right ventricle and left atrium and left ventricle. This is atrioventricular septum. Next, you need to know regarding walls. We have 2 kinds of walls in our heart. One is AV walls, that is arterioventricular walls. The walls which comes in between atrium and ventricles. The other one is aortic walls, nothing but your semilunar walls. The walls which closes pulmonary artery, and on the other side which closes aorta. So once they open, our blood flows out. So now over here we have got AV walls. First one is tricuspid wall, second one is bicuspid wall, and the other is semilunar wall. I said regarding semilunar walls. Over here you might get confused between tricuspid and bicuspid wall, the exact location. See, tri means 3, bi means 2. Most of you are right-handed. I won't say each one of you, but most of you. So the right-handed person his right part of the body will be stronger compared to the left. So it must be more, the greater one. So it is right. So the wall which lies between right atrium and right ventricle is called tricuspid wall. Is called tricuspid wall. This one has three cusps. On the other side, bicuspid wall has two cusps. The wall which lies between left atrium and left ventricle is called as bicuspid wall. The other name for bicuspid wall is mitral wall. Remember, mitral wall. It is called as mitral wall. Mitral wall. The normal name is bicuspid wall. Bicuspid wall. See, I said regarding semilunar walls, these close our pulmonary artery and aorta. This one is regarding anatomy of our heart. In the next video, I'll be saying regarding conduction of heart. Thank you for watching it, guys. If you like my video, please do share, like and subscribe, and please do comment for any suggestions. Thank you.